by Channel 4, the local station. This is Look Local.
Welcome to Look Local. I'm Karen Adams. This is the place where we showcase local businesses on the First Coast as well as local events going on around town. We do that by reminding you if you're looking for something to do or for someone to help, it is always better to look local. This week we'll be speaking with Dr. Sharma, a bariatric surgeon from New Life Bariatric Associates, about weight loss, management, and surgical options. Susan Angel from CNS Healthcare will be along to discuss migraine headaches as well as a problem of low sex drive for women. We're going to have some debate on that topic. And Richard Adams with Orange Theory Fitness will be here to tell us about his unique fitness center and workout techniques. But we begin with New Life Bariatrics. Dr. Sharma is here to talk about weight loss and gastric bypass surgery, and he brought along Rose Hillord, who is one of his patients. Thank you both for being in today. Tell us a little bit about, for those who may not know, what gastric bypass is and how it can help people.
Well, we offer different kind of operations, namely lap band, sleeve, bypass, and duodenal switch. Gastric bypass is one of the most commonly performed operation, and it works on two principles. One, we decrease the size of the stomach, making a new stomach which is called pouch, which is of the size of a golf ball. And
we have an actual picture of this in a graphic. So you actually reduce the size of the stomach. And if you take a look, the picture there on your left, you can see what the normal stomach, and see how it is detached. And what that is the new stomach, that little bitty pouch. So instead of having all the food fill up the regular stomach, what it is the food is filling up the smaller stomach, if you will, right there, so that we're getting less calories. Correct, doctor?
Exactly, exactly. And the second part, the stomach, which is the old stomach, still produces good digestive juices, bile, and all those stuff, but food is not mixing with that until you see at the bottom, it two connects again. So anything before that does not participate in absorption of calories. So this we call it as malabsorption component.
Okay, and that was one of the things when we talked about the actual graphic. I'm like, well, there's the other stomach, the big stomach. What happens to that? And he said it still has a use in producing the digestive juices,
right,
acidic juices, and so forth that are used
right,
throughout the digestive process. And I also want to bring in Rose, because Rose, tell us your story. You had gastric bypass, and it made a world of a difference in your life.
Yes, it did.
Tell us how.
Well, at first, you know, I was overweight, and I decided to go to Dr. Sharma's weight loss program. Mm-hmm. And I had a nutritionist and also Dr. Sharma here, which is my tool. And it just, you know, I put one and two together. One and one together equals two.
There you
go. With the nutritionist part and the surgeon part, made me who I am now. I've lost 120 pounds, and I'm more active. I do more, and I'm just so excited. I have a new life. I just feel like Dr. Sharma has saved my life. Wow. Because I was in a rut. I was in a dead end, and it was pretty bad.
He gave you new hope.
Yes, he did.
Okay. And so, you know, one of the things that goes along with this, and someone who does overeat, and 120 pounds you lost, that's the equivalent, yes, of another person.
Exactly.
So, so that makes you feel better on the outside, but, you know, feeling good on the inside. And whatever caused you to eat like that, maybe a depression issue or something, and getting the help that one needs to be able to go forward. You know, in your situation, it was overeating food, and yes, that was a depression. For many people, it's alcoholism or drinking to try to cope with some of the problems that they have in life. But in this case, Dr. Sharma turned this all around for you.
Yes, he did. Mm-hmm. A big turnaround. Like I said, he saved my life. You know, when you think about being overweight, I was pre-diabetic. I had been in and out of the hospital several times. ER visits time and time again, leg being packed.
Is that you? We're looking at the picture right there on the screen. Is that you?
Yes, that's me.
Oh, my.
That's me.
Wow.
I have come a long ways. I really have.
You certainly have. You look fantastic. It's amazing.
Yes, yes, it is.
And who is that with you there? That looked like
That's John Travolta.
It looked like John Travolta.
Yeah, that's
What do
my
you do-
friend.
What are you doing? Okay, now you actually have done some acting parts.
Yes.
And she's about getting ready to do some more acting parts. That was John Travolta with you.
Yes,
That's cool.
yes.
And so definitely being thinner when you have a job that puts you on camera
Exactly.
is important.
Yes, and also I have 3 casting directors looking at me now to do possibly some small parts in the new show Empire.
Okay.
So I'm looking forward to that as well.
Well, good luck and congratulations on the weight loss. Dr. Sharma, how does that make you feel? I know you're an experienced
I see
surgeon.
a lot of people, they have an inner desire to do something in life. But because of the weight and the medical conditions, they cannot fulfill their dream. Once we take off their weight and make them healthy, and if they have the desire, sky is the limit. Really, that's what we say. It's just not the outside we change, but the inner person too. And that's what we call new life. There are different kinds of operations, and we can customize the operations based on the need. Just like for gastric bypass, we can control the size of the stomach, amount of length of intestines we are bypassing, so to get the optimum results based on the need of the patient.
Mm-hmm. And Dr. Sharma is renowned. He's one of only a handful of surgeons in the United States that does laparoscopically do some surgeries.
Yeah, all 4 different kind of surgeries, and I do say every surgery has their own strength. It's right picking of the surgery and matching it with the needs of the patient. So if you execute it right and the patient have done their homework, usually it translates to great results.
Right. Okay. So basically what he's saying is there's 4 different types of different bariatric surgeries that you perform, and each one really specific to the actual person that's going to be undergoing the procedure. And, you know, I can just imagine looking at you then and looking at you now. I mean, what a difference, Rose.
Yes, there is a big difference, and like I said, being here today, being able to give back to the community, to tell my story, it helped me. I'm back, and I'm excited.
That's wonderful. Well, listen, thank you both for coming in. And as Dr. Sharma said, it's giving back a new life. And hence the name of the business, New Life Bariatric Associates. And his telephone number and the website is there on the screen if you would like to come in for a consult and discuss any particular options. He would certainly be available. Thanks again to you both.
Thank you so much.
Thank you.
Coming up next, if you suffer from migraine headaches, or if you're a woman who has a problem getting sexual satisfaction, we are going to talk about that with Susan Angels. She is from CNS Healthcare, and there are new medications that can help. Plus, the Harlem Globetrotters are coming to Jacksonville Memorial Arena. They will be here on the 27th, and you can watch the show at 7 p.m. Channel 4 is a proud sponsor of the event. For ticket information, you can log on to harlemglobetrotters.com.